Hi guys, my name is Leila Mkameli and I'm a counseling psychologist by profession. I also work as a school counselor and I'm volunteering as a counselor at Parklands Baptist Church. So today I'd like us to talk about trauma. Trauma, what is trauma? When you hear trauma, what comes into mind? So trauma is basically the body's powerful emotional reaction towards a stressful or a distressful event. And it could be things like accidents, death of a loved one, abuse, or war. So those are some of the things that we could characterize as traumatic events. So when it comes to trauma, how do we treat it? Basically, if you go to a mental health professional, there are 4 basic ways in which you treat. 1, we use cognitive behavior therapy. Number 2, we can put you on medication. Depending on how you're reacting, probably you're too anxious, you're completely not able to sleep, so you can't be put on medication. 4, we can put you on other methods like hypnotherapy. It depends on the situation and what exactly you need. And then we have other ways like exposure therapy. So those are the main ones. But today, I'd like us to mainly focus on trauma in children. And when I talk about children, I mean children and adolescents. I think that's a better category. So we will look at ages from 0 to 2, and then we'll also look at from 2 to 5. We'll look at 6 to 11, and then the teenagers, that is 11 to 18-year-olds. So what are some of the helpful ways in which you can help children who are going through any traumatic event? So number 1, you need to make your child very, very comfortable. Make sure that your child is safe. Make sure that the child knows that they are safe. You can act calm. Always act calm with children because they will feel when you're anxious. We can also maintain routines. Help your child enjoy themselves as much as possible. If it's playing, allow them to go and play. Share information about what is happening. Like right now we are facing COVID. So let your child know that there's COVID, the things that are supposed to be done, what is going on in the world. Then you can limit the news. You know how the news is and what is covered in the news. And that can really be detrimental to a child's progress because then they will think that the situation is repeating and recurrent on a daily. So that will really hamper their progress. And then we need to listen to them. Listen and listen well. And then please acknowledge, always acknowledge what they're feeling. Don't dismiss them. When they tell you, I'm worried, don't tell them, no, don't be worried. Everything is okay. No, acknowledge and tell them, yes, I know. I can see you're actually worried. And when you acknowledge that, they feel like you are listening to them and you're hearing what they're saying. Know when to say you don't know. If you're uncertain and unsure, it's okay. The child just needs to know that they can come back to you and tell you how they're feeling. Realize when the questions are persistent and be comfortable with them. Plus, you also need to encourage the discussions, like if maybe there's a death of a loved one, just encourage that conversation. Please don't overburden the children with responsibilities. Like if it's a firstborn, don't let them take over the role of a parent who's not there, or a parent maybe if you're completely unable to. If you're unable to, allow another significant adult to come in and take over the roles. But they can simply take up some chores, and then give special attention to special needs kids. Like if maybe they have a language disability, use visual prompts to explain. If they also are struggling with understanding what is going on, simplify the language for them to understand. Never leave them out. It's very important that they are aware of what is going on, and that information is very crucial for them. You can also exercise as a person because that's the best thing you can do. Because eventually, if you're helping yourself, you're also helping your child. So what are some of the signs of trauma in children, generally, all ages? Well, the kids can be irritable. They can resort to unhelpful behaviors like drugs. Be very watchful with teenagers. And then they can be aggressive, whereby they are bullying others, beating others. They can also have constant nightmares, whereby they can't sleep and they can't really be on their own. They can be clingy and completely unable to function like they used to, like going to school. And they can also struggle with detachment or withdrawal from others. So it depends. So some will just withdraw from their friends and they're just want to stay away from everybody else. So we have poor concentration in class. This, I'm sure the teachers will really help you, because then they will be able to pick it up very fast. So all in all, what are some of the helpful ways in which you can help our children cope with trauma? Number one, you have to seek help as a person. You need to take care of yourself. You can only do justice if you're able to take care of yourself. So all this, you also need to take care of yourself. Meaning you form a support group, join a support group, get help from the local support groups around. You can pray about it. You can also just form some support system whereby you are able to express what's going on and how you're feeling. Because then when you're stable, then the child is able to get the support and help. Know when to seek help. If you need help, always know when to. Like if it's overbearing and you're completely feeling overwhelmed, seek help. Go for therapy, go for counseling, go for prayers, but just seek that help that you need for that moment. Watch out for signs of trauma. In case the child is overreacting, overly anxious, re-experiencing the emotions, they are completely not able to function. And probably maybe they are hurting themselves, like cutting, banging their heads on the wall. So some of the things you really need to seek help for the child. So some schools offer that support. Some churches like Parklands Baptist Church has that support as well. So you can seek help from any other place like school, church, and I'm sure even the community, there are so many other ways in which you can seek help. Or talk to your GP doctor, so then they will see how to recommend and how to refer. So let's look at the focus areas, 0 to 5. Yeah, 0 to 2 for starters. So what do? You try as best as you can to keep a routine. Make sure that the child also feels very comfortable, and look at the child in the eye. Continue breastfeeding if you're breastfeeding, if it's a mom, and then look at your child. Always just take care of their needs when they need that support and help. Because anyway, children at that age are able to recover very fast, but they're very sensitive to when you probably not continue with the routine. So they will be sensitive, and it can be detrimental to their support and to their growth. So always keep a routine. What about the ages of 2 to 5? So that's the age where they have significantly developed. They are more aware of what is going on. They are more aware of their surroundings, but they are still are able to recover very fast. So again, make sure that the child feels safe. It's very important. Watch what you say, because they'll pick it and it will stick in them, and they'll even remind you that what you said. Give extra support during bedtime. Like I would suggest that you can buy them a stuffed animal. You can allow them to sleep in your bed for a while, but let them be aware that once they are able to get back and they are comfortable enough, they should go back to their rooms and to their beds. You can also teach them how to breathe in and breathe out, and that is done when you can use a feather on just near the nose. Let them breathe in with the feather as the feather is breathing in, and then put a stuffed animal or an animal on their belly. As they breathe out, they see how the belly is moving down or moving up, and then you count 1 to 3. That helps them with their feelings and their emotions. So it actually helps them to calm down. Encourage the child to share their feelings. Just prompt, ask questions. Do not expose the child to news. They are not really able to differentiate between fears and facts. And if they keep watching the news, it will really affect them, and they will not really be able to filter out what is true and what is not. And you know how our news reports are. They are always exaggerated, they are heavy, and sometimes the content is graphic. So please limit that exposure. Then you can allow them to draw. They can draw a picture of how they're feeling. You can also let them act it out, especially at that age. Play is very important. And then let them be engaged and involved in activities. You can allow them to help in house chores. You can also allow them to participate in the local community activities. Now, the challenge right now is that we are really self-isolated. So I think mainly working and doing chores at home will just be helpful for the child, because now they're not really able to mingle. And then try to talk about what is going on, and let them share how they're feeling. Now, what about the ages 6 to 11? Again, they still think that this is the age where they are now more aware, but then you need to be concrete, and you need to explain it in a language that they can understand, whatever it is that is going on in their lives. So help the child, again, reassure them of their safety, reassure them of their friend's safety as well. Like, let them know, you see, even your friend is being taken care of. That's the same way I'm taking care of you, or I'm taking care of you, even your friend is being taken care of. Because this is a very social age, and they'll be more concerned about their friend's safety and maybe their family's safety, so reassure that. Make things as normal as possible. If they had a routine, keep that routine. Always keep the routine for these ages, because then it helps them with their recovery and their support. Kindly, please always remember to limit exposure. Again, this is the age where they're not really able to differentiate what is right and what is not, and they can take in a lot. So it's very, very important for you to limit, and if they have to watch with them so that you allow them to ask the questions, but always filter the content for them. Spend time with your child. It's very, very important. Spend time with a child that needs help, and then give answers. Briefly, yes, concrete in a language that they can understand, but answer. And it's okay for you to say that you don't know. It's okay. You can always say you don't know. Let your child talk. Draw them to talk. Some kids are not really comfortable talking, but whenever you have a chance to talk, let them talk it out. And then allow them to just understand that they're different. Allow them to understand that we are different in the way we respond to issues. Some will cry, some will not. Some will be withdrawn, some will be more talkative, some will want to continue with their routine, some will not. So just be very open to the child and understand that children are different and they cope differently. Keep the children busy. Yeah, it can be a very good distraction, whereby at least there are chores, there are things they are doing, so they're not really occupied with what is going on in the environment, especially now. You never know if they are not taken, if they're not kept busy, they can easily go into the internet and just be preoccupied with the information that is going on. Talk about the community recovery. Like right now, we know that some countries, some countries have already picked, and the situation is not as dire, and some it's very bad. So let them just talk about it and explain to them about how the community is working and how we are ensuring their safety. Encourage a lending hand. Always be there, supportive, and support the child in any way that they can. Find the hope. So you let them find that hope. Let them know, yeah, it's sad, I'm also hurting, but there's hope. We are Christians, we remember that there's hope in Christ. So that's where you come in, and you can use scriptures and verses to just encourage the children that there's actually hope. Now, what about the ages 12 to 18? This is more of like a difficult situation and a difficult age. We don't know. When it comes to teenagers, there's a lot of transition, there's a lot going on. But this is the age where now they are aware. They can think more abstract, and they are more aware of what is going on. So this is an age where you really need to be careful with the child. And typical reactions with an adolescent, why I'm really emphasizing on this, especially with the reaction, is because it's a bit different from the other ages. So they will try and avoid the feelings. They will constantly think about the disaster that has happened. They will have anger or resentment towards either one person or the other on the same. And then they will have extreme depression or sometimes sadness, and they will verbalize. They'll tell you, Mom, I'm depressed, or Dad, I'm depressed, or I'm extremely sad. That's the good thing about it, if they can trust you. If not, they will not tell you, but they'll always let it out, either in the social media, to their friends. So just be watchful of them. Now, again, make them feel safe. It's very important. Help the child feel helpful so that they are able to help in the community and in every choice so that they feel significant. That will help, because there's a sense of loss when there is trauma. And then help open the discussion, open room for discussion. Let the child be able to discuss, ask questions, give their input of how they're feeling. Consider peer groups. This is the age where they function most and they really work together with groups. So if you can easily link them up with their friends, now with the COVID and the situation, it's good if you can use Google Meet, you can use Zoom, but let them work as a team and as a group. That goes a long way, and you'll see a lot of better recovery with the child. Limit, again, exposure to newspapers and TV, because again, the information that comes through, they're able to filter, but they're not able to handle it, especially when it's overwhelming. They don't have the mental capability to handle it. Now, seek help when the child needs that help. If they start self-harming, if they're completely functionally impaired, extreme anxiety, always seek help. And there's a lot of ways you can help the child. You can allow them to draw, just express those emotions as they come through and validate their emotions. But be very, very aware. This is a caution to all the parents and caregivers. Always be aware of drug and substance abuse for this age. It's very easy for them to numb it with drugs. It's very easy for them to now get the exposure because the emotions are overwhelming. Now, how do teachers help? Number one, teachers will allow the kids to resume routines as soon as possible and then manage and maintain the expectations of the students. Because again, remember, when it comes to children, we are working as a team. We have the teachers, we have the Sunday school teachers, we have now the carers or the parents who are also involved, and we have the community as a whole. So if you work together as a team, then we'll be able to help the kids to recover from trauma. So the myth that goes around is that children will recover first. But again, children are just like any other person. They're just like adults. When it comes to trauma, they also experience the pain, the emotions are there, and they can re-experience it for years and years after. So let's not assume and negate the fact that they also can be affected with trauma. In case you have any issues or any problems or if you've suffered any traumatic event, call the number below for prayers and psychological support.